Hello, everybody. My name is Glenn Schneider, and I am the Chief Program Officer at the Horizon Foundation. And thanks so much for coming to listen to my stuff before your class day on February 2nd. I am excited to share this stuff with you, and I look forward to seeing you in person, or at least on Zoom, on February 2nd. So why don't we go ahead and get rolling. The foundation, just so you know, our mission is to improve the health and wellness of the people that live and work in our community. Our vision is so that everyone lives long, healthy lives. And certainly over the last 21 years that we've been around, we've given out about $60 million, and we have certainly worked with and partnered over 300 different times with different organizations and initiatives. Our role, we see ourselves as really leading community change so that people can live the long, healthy lives that they are destined to live here. We have three strategic priorities: supporting healthy kids and families, which is nutrition, physical activity, and mental health for families and their kids. Certainly promoting healthy aging, which in our case is really looking at all of aging over time. We are certainly doing a lot of work on advanced care planning to make sure that people get quality care at the end of life, as well as looking at palliative care and a number of other issues there. And then lastly, ensuring that we all have a more equitable community, and particularly facing the idea that not everyone has equal access to long, healthy lives here in Howard County, and that we can do better. So how do we do this work? We have the 4 Ps. We start with programs. That's through our grantees and our partners that do all the great work that keep us moving towards good health in our community. Secondly, we have a very important lens of policy. We look at policy and say if there is an issue out there that is causing health problems, it's likely related to a policy or a system that we need to reform. Third is people. That means essentially you can't have public health with having people be a part of it. And we do that through both our media work. We have a lot of media that we have, both social media as well as TV commercials and all the rest, as well as partnerships with organizations throughout the community that we do our work with. And lastly, we are a community health foundation, your community health foundation, because we have the ability to look at all of these things together. We should certainly be able to show you that we are making progress towards it, and that happens with proof. So perhaps you've heard of us in the community. We have a number of different initiatives that we have worked on over time. Hopefully you see something in here that sounds familiar to you. We'll talk a little bit more about some of them moving forward. When we talk today, during the Health Day, you're going to hear us talk about a lot of different institutions. We have got world-class institutions here in Howard County when it comes to health care. You have probably interacted with many of them or many of the providers out there. This sort of, when we think about Health Day and healthcare in general, we think that it is all these organizations, but it's also you and what you choose to do or don't do when it comes to your health. We're going to talk a little bit about that moving forward. Next, I wanted to kind of give you a sense, as you listen to other folks today through the recordings and at Health Day itself, you will hear Elizabeth Crom talk a little bit about population health. You'll hear me talk a little bit about public health. And you might say, what in the world is the difference between these two? Public health is about all of us together. The population of Howard County residents, looking at our health from that angle, from that standpoint, is what public health is all about. However, when you think about it, in thinking about us, there's also this thing called population health. And it's a combination of what I would call clinical health, the kind of health that you get when you go to the doctor and your doctor talks to you about what should change or shouldn't change, and combining that with public health, which is the population as a whole. And in that middle, that little Venn diagram, in the middle of that is population health, where we are trying to make improvements in someone's health, really thinking about how we partner with the clinical side of things, as well as look at the public health side of things. So you're going to hear Elizabeth talk a little bit about that later on. But first I wanted to pause and say, this is me, by the way. This is when I was young, learning how to ride a bike. Dig those shorts, dig that bike, right? I had a bell. Anyhow, this is me then. And I think about all the changes that we've experienced, and now I think about me now. And as you can see, I mean, things have dramatically changed. And I wanted to help you think about it and process it as you go throughout Health Day in the following ways. First of all, I want you to think about this. This is really important because this might to some of you, be a surprise. And that is essentially, I can predict your health based on where you live. Your zip code is a better predictor of your health than your genes. And that is a really important statement because it's sort of important to what I have to talk about today to you. And certainly if you think about Howard County, you think of all the great spaces that we have and all the different things that makes Howard County great, that does not happen by accident. That was certainly policy choices along the way that we need to talk about here today. And certainly Howard County is all of these things. We are the best place to raise a family, good sports community of the year, best library in the world. You've heard of all these accolades. This is fantastic. However, we're also a community that struggles. We have struggles like every other community with racism, as a matter of fact. We're going to talk a little bit about how that impacts your health today. And in fact, I can tell you that when you even take zip code and say, hey, Howard County, we should be doing pretty well, right? Because we are living in Howard County, we have affluence, we have educational attainment and all the rest. There are still, if you look at overall health and wellness and economic opportunity and all the things that you're going to learn about in leadership, you will see that there's still disparities because of racism. I just wanted to show you this one thing here. This is white children from poor families in this part of Howard County makes $52,000 a year. That's what they are expected to make in their income. However, black children from that same exact community are only expected to earn about $35,000 per year in their adult households. This is not because of a person's color or a person's ethnicity or anything like that. This is actually due to structural racism in our healthcare system, in our housing, and a number of other community structures. So the idea of policy is important. That's what we're going to talk about today in my particular part of the talks. And how does that get expressed? How does racism get expressed? Well, maybe it means over the course of time. Take this one example. This is one part of Columbia, actually, that has a very high population of African Americans living there and lower income residents as well. Howard County over those years chose not to invest in the kind of infrastructure like sidewalks and roads and safe roads and bus stops that we should have in order to make sure that people can get around. That's how we start seeing structural racism and its impacts on our overall community, and that affects your and my health. So ultimately, just remember, this place matters. What we choose to do in policies and systems matters in our community. It's important for you to think of that as you go throughout Health Day and throughout all the different days of leadership moving forward. So I'm going to stop with a mic drop moment right now and tell you, improved community health requires policy change. If we want to see better health, if we want to see better outcomes, we have to change the policies that we have in our community, just like anywhere else does around the country, for us to see that happen. And I am going to prove it to you. So I want to give you a couple examples. Let's start with this one. How many of you right now, if I asked you, remember that you could once smoke on planes? Anybody? I think there are quite a few of you who might. I know that I remembered when you could smoke on planes, so it's not all that long ago. But how about smoking in your workplace, where you would walk into a room and it was a blue haze about because so many people were smoking, or perhaps restaurants and bars. It's not been all that long since we haven't seen smoking in restaurants and bars. And in fact, there were times that your doctors really came out to tell you that you should smoke Camel. No. Was it Lucky's? No, it's Viceroy's. In any case, your health professionals were also a part of this and talking about what it is you should smoke or not smoke. And as a result, what did we see? We saw that by 1943, we had nearly 80% of men in their 30s who were smoking daily. That is a big deal. And as you can see, over the years, that came down partially because people who were smoking died, but also because we made some changes in our community that I'll talk about. Number one, we had education. Surgeon General came out and said, oh, by the way, it's not a good idea to suck smoke into your lungs, and it in fact leads to lung cancer. Education helped. But it wasn't until communities started doing something amazing. They started experimenting with policies and systems change, because they knew that if we wanted to see a change ultimately, we had to usher that change along as a community. In Howard County, we have made many, many changes over the decades. Take a look, you'll see them all here, and I will tell you that those policies have had impact. Certainly along the way, we have had debate, a lot of debate. This is just one example. When it came to smoke-free air, we talked about, is it a good idea for us to have smoking in our restaurants, public places, et cetera? Doesn't everyone deserve smoke-free air? And then there were people who said, wait, government has no right to tell me what to do in my businesses. Smoking is legal. Why can't I be allowed to smoke wherever I want? These sort of questions were being aired in the public circle, and that was an important part to all of this. We also had, of course, while all of this was going on, newfound money and policy changes in looking at media so that people were getting educated through other ways as well. But ultimately, over the years, we learned that there were a number of policies that reduced smoking, and communities across the country started experimenting with these. Through the evidence base, we knew that these were the policies that would have the most impact on reducing cigarette consumption and reducing smoking at the end of the day. And what can I tell you? It's this. This is one of my favorite charts ever. If you look at this chart, it shows you that every single time that we saw a reduction in smoking, it was due not because we were knocking on everyone's door saying, hey, smoking's going to hurt you or anything else. It's because we changed the policy. Whether it be a smoke-free air policy, or we raised the price of cigarettes, or we had a media campaign, or a number of other things, we started seeing consumption drop in the state of Maryland because we changed the policies to allow it to happen. And what happens as a result? In Howard County, we now have less than 5% of people who are daily smokers in Howard County. That has meant so much to our ability to have healthier people here in Howard County than elsewhere. Smoking rate decreases, health increases. That's one example. So again, mic drop moment. We wanted to change our overall tobacco use and improve good health. What did we do? We changed policy. The policy led to better outcomes. The better outcomes are why we have a healthier community today. Mic drop moment. Example number 2. You're going to hear Allison talk about health insurance. In her talk, it's all about health insurance. And let me tell you this. You might remember the Affordable Care Act. I certainly love Obamacare. I think it's a great idea. However, not everyone loved it. In fact, we know that the U.S. House of Representatives voted more than 50 times to get rid of it. We know that the Trump administration started passing regulations and rules to weaken it. And lastly, states' attorney generals in half the states went to try to get the courts to get rid of it. So what do we know about that? What does that mean? Well, some states chose not to implement key parts because the administration allowed them to do that. That means the states in orange didn't actually expand Medicaid the way that the Affordable Care Act allowed. The other states did. But ultimately, what did we see? We saw that this policy took a huge chunk out of the number of uninsured that we had. We had 44.4 million people who were uninsured. That dropped to around 20 million. Think of it, a 20 million person difference in the number of people who had access to quality, affordable health insurance. That's a big deal. And who had the gains? Who had the most gains? Well, as you can see, we had gains across the board, but primarily, if you look at this, this was also something that really, on an equity scale, made it easier for people to live that good, healthy, long life that we were talking about. So this was an equitable law in addition to being a law that benefited across the board. And lastly, why is it so important to you and me? Because we know that if you are uninsured, you are going to have a harder time paying for care and being healthy overall. We know that that's the case. That's been shown in study after study. But I think, suffice it to say, when we increase the number of people with quality, affordable health insurance, we decrease the number of people who are going to be experiencing not only economic shocks because of health, but also better health in general. And we're starting to see that today. The overall health impact of the Affordable Care Act, the jury is still out. But we are starting to see impacts when it comes to cardiovascular disease and things like that because people now have the insurance that allows them to go see that doctor earlier than they ever did before. Example number 2, mic drop. You wanted to see a change in the number of people with insurance so that we saw better health outcomes. We are in that process now. It is not without community debate. It is not without people sparring back and forth on the idea of whether this is good. But ultimately, in health, if you want to see changes to your overall health condition and improve your health status, it requires policy and systems change. Last example. I told you before, we have bucks and brains in our community. In public health, you have bucks and brains, meaning you're a pretty affluent community, which any given time, Howard County is in the 4th or the 5th highest income per capita county in the United States. If you add that with educational attainment, we should be doing fantastically better than any other community around the country. Around the country. And I will tell you, when you look a little bit closer, look a little bit in there, you can see Glen Allen, Elk Ridge, and all the other places. You will find out that we're still dying of the same kind of chronic diseases that most other people are. Certainly, if you take COVID out of it, we see most of our deaths are still being caused by heart disease, cancer, stroke, and diabetes. Very same to Baltimore City or a number of other places. And we also know that we have a lot of risk factors as well: high blood pressure, high cholesterol, excess weight. All of these things are leading to those chronic diseases that are taking us early from our families. We know that our weight status and our weight trend over time has become worse. That decreasing arrow is not a good decreasing arrow. That means healthy weight is on the way down. We know that diabetes is exploding. We're seeing a quarter of kids today. We're talking about teenagers being diagnosed with diabetes or pre-diabetes. We know that overall across the country, diabetes has gone up. So in any case, the foundation and partners, we went searching for the cause. It must be potato chips. That's what we said, because potato chips are tasty. It must be, no, it's the French fry. Clearly it's the French fry. It's a cousin. No, it's pizza. Pizza is so delicious. The USDA has declared pizza a vegetable when it comes to school lunches. Fact. No, it isn't. It's the amount of junk food on every corner of the grocery store. It's got to be junk food and candy and things. No, it's fast food. Everywhere where you blink an eye, there's a fast food restaurant. It must be fast. No, it isn't. It's because we don't eat enough fruits and vegetables. And it is very true. Howard County is no exception here. It's not like we're eating a ton of fruits and vegetables every day. No, it isn't. It's exercise. You know, you got to exercise. Is it 30 minutes a day? Is it an hour? It's so easy to get. No, it isn't. It's the intensity of the exercise. When we went searching for what we do about this, we had nutrition, we had physical activity, we had sleep, we had a number of different things. All those things I talked about, we had to ask for some help. And what they told us is this. They said, no matter what you do, start with kids. Kids have a great place where if you change their environment through policies and systems changes, you're going to make a difference. Because kids, when it comes to all those risk factors, particularly when you think about weight and what food and exercise, what kind of impact they have on weight, kids only need to lose 5 to 7 pounds for them to be in a healthy weight range. Much easier for them than adults. Next, they said, by the way, exercise and nutrition are both important, but nutrition is far more important. They said, we are at a point now where we are not going to outrun the kind of problem that we have in our community when it comes to chronic disease. And they said, if you're going to look for nutrition, where do you start? You start with sugar. Why? Because our sugar consumption is exploding and has been exploding because we consume far more than anyone else should be consuming at any given time. And worst of all, they said, if you consider the folks who are promoting unhealthy food and unhealthy drinks, we are outspent. Meaning you combine all the foundation's money around the country, the government spending on this, everything else, you combine all that together, we are outspent by the food industry, particularly by January 4th, who are typically putting a lot more advertisements out there for the less healthy food than the healthy food. So that's a big deal. Then they said, by the way, the best place to start is looking at sugary drinks. Why? You can see there's a lot of sugary drinks on the market, but we know from what the health experts say, it is the largest source of calories and sugar in our diets today. Still is. has been that way for a while. We know that kids, even kids as young as 2, are having way too many sugary drinks in their life already, and that continues throughout their teenage years into adulthood. We know that independently, sugary drinks are a big cause of disease and a risk factor for other diseases. So it's a big deal. And when we went out and surveyed our own 6th graders here in Howard County, we found that they were having a bunch of calories and sugar every single day from sugary drinks. A big deal. By the way, it's enough calories. It would be like a McDonald's cheeseburger every single day for every single kid that we have in our community. So what did we do? Together with partners, we went out and said there must be some policies and systems that we should change in order to see things happen. And we had a roadmap that we started to follow. We educated the heck out of people. We said, you know what, there are better drinks out there. You don't have to be stuck on the sugary stuff. You can try other things as well. We educated, we talked them to all the different families at community picnics, at the pool, at sports parks. We started showing them how much sugar that we actually have in a lot of these drinks. And we educated the business community. We talked to everyone that you can think of, and then we started asking for changes in policy. First place we went to was really looking at the school wellness policy. By the way, before 2012, we had one of the worst wellness policies in the country, which you would say that's crazy for a place like ours, but it was true. We went through a process working with you, and many of you and many of the folks out in the community to make that change, and we made a big change to that wellness policy. So on paper it changed, and then we've spent many, many years afterwards making sure that it was implemented. We also improved what was happening with childcare, because we know so many kids are in childcare every day. We made sure that kids had healthy food and drinks available to them, and that we made that mandatory for any childcare facility that's out there. We started working with community organizations, including our own hospital and the Hopkins system in general, to change what they were offering in their cafeterias, in their vending machines, and so forth. We talked to providers to make sure that they knew the importance of sugary drink consumption and its impact on kids, and they were big partners in trying to change what people were drinking on a regular basis. Again, small changes, trying to shrink the elephant to make sure that we could take bite-sized pieces out of this problem so that we could have major change. We also changed the vending machine policy and what sort of food and drinks we're offering to kids in rec programs here in the county. And there was a lot of debate. Just like I told you happened on the Affordable Care Act, it happened on this as well. There were arguments for things like healthy vending or anything that we worked on, and there were arguments against. In any case, there were newspaper articles, there were people talking about it over lunchtime at work. Can you believe what was happening at the county? Do you know what kind of laws they were trying to pass? It was big on social media. And then all of a sudden we saw that the work we did here, after we passed it, it started to spread, which is fantastic because not all Howard Countyans live and work here. There are many people who work outside of our community, and we wanted to make sure that change continued there as well. So we started looking at our playlist, and we started checking off those boxes, and that has made a difference. Sales, soda sales, and sugary drink sales are dropping faster here in Howard County than the rest of the country. That's good news number one. We know from evaluation, working with the Rudd Center for Food Policy and Obesity at UConn, who's evaluated our work over time, they said, not only have you done a good job, you've reduced sugary drink consumption by 20%, when you compare it with a control community. And how did you do it? It's through that combination of policy work that you did and education. So what's next in all of this? We look at this and we think about the impact of COVID on our community, and we found that people who had chronic conditions, especially diabetes, were far more likely to have more serious consequences from COVID. This is going to be true in our community no matter what. It's also true that if you have more chronic diseases in your life, you're also more likely to spend more time in a nursing home in the future. You know, there's impacts for your health all throughout. The less healthy you are, the more impact it's going to have on your life, no matter what. You always hear that saying, all we end up having together is our health. That's the thing that brings us most together, and that is true. So again, as I said before, diabetes rates keep going up. In Howard County, there's 90,000 people or so, or 100,000 people or so that have diabetes or prediabetes. We can do something about this together. We're all just starting this work. Hope you will join us in that effort. In closing, I wanted to show you why policy and systems work matter. The big why to this. Why are you doing this? Why does it matter? There's a couple key things. One, policy change work that we do focuses individuals' behavior on something. So, for example, when we talk about sugary drink consumption in the community, it's something that is easy enough for people to wrap their arms around. We had focus groups with people in our community who said, you know what, you public health people, when you tell me exactly what I need to make it better for my family, I'll do it. But you can't tell me that it's this, and this. Just give me one thing to work on, and I can work on it. And that is certainly what we've tried to do. So it focuses people's behavior and their interest on one particular thing that's happening. It creates a lot of discussion. As there is debate in the community for and against the policy, it makes a big difference. Thirdly, the change that we're talking about by itself is going to have an impact on the behavior or the health of a person. And let me give you an example. I'd call this more on the stealth health side of things, but let me give you an example. When we passed smoke-free air laws, what we learned is we automatically improve the lung capacity of workers who used to work in a smoky place. So bar workers, for example, waiters, waitresses, etc. That's not going to be a surprise to you. But what might be a surprise to you is that the people who thought about smoking and quitting, they ended up trying to quit more often because now you couldn't smoke anywhere. And they got tired of that. They didn't want to go outside and all the rest. So they ended up trying to quit. And we know that when you try to quit, at some point, you're more likely to be successful. And so we had more people quitting. But then there was a third impact, and most people were shocked by this. But immediately after smoke-free air laws go into effect, the amount and the rate of heart attacks in the community go down because secondhand smoke was a major trigger for heart attacks that was previously unknown that it could happen that quick. So these are just some examples of when you change the law, there's an impact on health both immediately and in the long term. Another great example, we know from the evidence that when you build better, safer bike paths, streets, bike lanes, etc., you are more likely going to have people use them more often to get around. Shocker, but it's the truth. We also know that when that happens in communities that have been historically underinvested in, that we start seeing changes in amount of physical activity and how safe particular stretches of roads are. Those sort of things make a difference. And lastly, policy changes help us to expect something different for our lives and our families. I want to show you how that all comes together. The idea is policy and systems changes, we should be thinking big. When you go through leadership, you should be thinking about how can I change the policy, whether it's on aging or housing or health or whatever else that you care about, and say, when I do that, I know that I'm going to have the results, hopefully, that I'm looking for and I'm intending. So last story for you. This is my older son, Eric, who is now a sophomore in college. This happened when he was about 11. I want to tell you this story. Anyone ever play Cranium? Raise your hands. I can't see you. But in any case, if you've ever played Cranium, you can do a lot of things. It's categories. It's adding a bunch of different board games together. In any case, we were playing, my wife and I and my two sons. I was paired up with my older son. My wife was paired up with my younger son. And one of the things that you do in Cranium is you take some clay. One person has to sculpt something, and the other person has to guess what it is. Easy enough. So, all right. So my wife takes the thing, and my kid turns the timer over and says, go. So Eric picks up the card that he's supposed to look at and then sculpt. And he's looking at the card, and he goes like that. He's looking at it, and he goes, I'm like, Eric, the timer. He's like, and I'm starting to wonder, like, what in the world? I'm like, what's going on? What's wrong? And he goes, I don't know what this is. Now, I have to tell you, for a person who's done a lot of work in public health and all the rest, I started to fear what was on that card. But you know what it said? It said, ashtray. My 11-year-old son, living in Howard County, did not know what an ashtray was. And as a guy who's been involved in public health laws and policy work for all of my career, especially in tobacco control early on in my life, I couldn't believe it. I think I was speechless. I might have even started crying. I think the idea is, what happens if we start changing the environment in which our children live today? And so even taking sugary drinks, for example, if kids didn't have an idea that sugary drinks were rarely in our house, so I didn't have it there, and they weren't being served to me in my childcare or at school or at my Rec and Parks programming. I rarely ever saw it. I didn't really ever use it a lot. All of a sudden, I eliminate that part from, other than being a treat every once in a while, it becomes a treat. What happens if we do that on all the things that we know impact health and policy across the board, and we give kids different experiences than what we grew up with? It would make such a big deal. I think about that even on smoking. I will tell you again, I made ashtrays for my parents in shop class. And here my 11-year-old son had no idea what it was. Policies and systems matter. They matter to that idea of zip code being important. Those great things that you think about Howard County didn't just happen. They happened by choice. They happened by policy and systems. That's what created them. That's what changes things over time. So you want to make an impact on health, change the policy, change the system, it will happen. And that's a key thing to be thinking about throughout Health Day and throughout the days to come in leadership. Questions? I look forward to talking with you on Health Day on February 2nd. But overall, thanks so much for tuning in and listening to me. I can't wait to see you on Zoom at the very least soon.